How do you guide your patients through their first injection with the KESIMPTA Sensoready Pen?
Before my patients take the first dose, I find it's important to explain potential injection-related reactions and how I recommend managing them, so kind of giving them some upfront information. All my patients receive guidance from someone on my team or myself on how to take KESIMPTA the first time they use it. And I give my patients branded information on how to perform the KESIMPTA injection. We also have demo pens in the office, and my nurse is ready to provide in-person or video visits for education and training as well. And if someone's super nervous, I just tell them to come into the office and we'll help them with the injection. We don't have any, practice-specific protocols per se, but I do tell my patients, call me if they have any concerns. I'm always available.
I also made sure that they knew what to expect in terms of potential side effects and how to handle them if they occur. My patients found it reassuring that the injection-related reactions with KESIMPTA were mild to moderate and typically only happen again on the first injection, although they certainly could potentially happen with subsequent injections. Most of my patients were really just worried about the administration itself or how to use that Sensoready pen. So the Sensoready pen itself has a lot of features that helps patients perform that injection correctly. And just showing them the sample pen in office really tended to reassure patients that they could do it themselves at home. For example, the pen uses a loud click, and then there's a green process indicator to verify that the medication has been delivered. There's also a little window if you wanted to see so you could kind of watch that. So my patients also like the fact that there is no visible needle.
Sarah, how is your experience with the Sensoready Pen?
With the Sensoready training pen, I realized how easy it was to use. I thought, I can do this. This really eased my concerns. I could practice with the pen and multiple times. And I just felt really comfortable that when it was time to do my real dose, I could do the injection without needing help from anybody.
I like that there's no visible needle. I sit down on the couch in my living room. It's very pleasant. I can just look around and, it's comfortable. It automatically injects when I press it firmly against the skin. And so I don't have to worry about whether I'm doing it too fast or anything like that.
How has the Sensoready Pen helped your relapsing MS?
Right now, KESIMPTA is delivered right to my house. It just shows up on my doorstep. So it has simplified things in a big way for me. I like that it's once monthly, and I've been able to stay right on time with my doses. I've not missed any doses. When it's time to take my medication every month, I just give myself the injection at home.
Indication. What is KESIMPTA, ofatumumab injection? KESIMPTA is a prescription medicine used to treat adults with relapsing forms of multiple sclerosis, MS, including clinically isolated syndrome, CIS, relapsing remitting disease, and active secondary progressive disease. It is not known if KESIMPTA is safe or effective in children. Important safety information.
Who should not take KESIMPTA? Do not take KESIMPTA if you have an active hepatitis B virus HBV infection, have had an allergic reaction to ofatumumab or life-threatening injection-related reaction to KESIMPTA.
What is the most important information I should know about KESIMPTA? KESIMPTA can cause serious side effects such as infections. Serious infections, which can be life-threatening or cause death, can happen during treatment with KESIMPTA. If you have an active infection, your healthcare provider, HCP, should delay your treatment with KESIMPTA until your infection is gone. KESIMPTA taken before or after other medicines that weaken the immune system may increase your risk of getting infections. Tell your HCP right away if you have any infections or get any symptoms including painful and frequent urination, nasal congestion, runny nose, sore throat, fever, chills, cough, or body aches. HBV reactivation. If you have ever had HBV infection, it may become active again during or after treatment with KESIMPTA, reactivation. If this happens, it may cause serious liver problems including liver failure or death. Before starting KESIMPTA, your HCP will do a blood test to check for HBV. They will also continue to monitor you during and after treatment with KESIMPTA for HBV. Tell your HCP right away if you get worsening tiredness or yellowing of your skin or the white part of your eyes. Progressive multifocal leukoencephalopathy, PML. PML may happen with KESIMPTA. PML is a rare, serious brain infection caused by a virus that may get worse over days or weeks. PML can result in death or severe disability. Tell your HCP right away if you have any new or worsening neurologic signs or symptoms. These may include weakness on one side of your body, loss of coordination in arms and legs, vision problems, changes in thinking and memory, which may lead to confusion and personality changes. Weakened immune system. KESIMPTA taken before or after other medicines that weaken the immune system could increase your risk of getting infections. Before you take KESIMPTA, tell your HCP about all your medical conditions, including if you have or think you have an infection, including HBV or PML, have ever taken, currently take, or plan to take medicines that affect your immune system. These medicines could increase your risk of getting an infection. Have a history of liver problems. Have had a recent vaccination or are scheduled to receive any vaccinations. You should receive any required live or live attenuated vaccines at least 4 weeks before you start treatment with KESIMPTA. You should not receive live or live attenuated vaccines while you are being treated with KESIMPTA and until your HCP tells you that your immune system is no longer weakened. Whenever possible, you should receive any non-live vaccines at least 2 weeks before you start treatment with KESIMPTA. Talk to your HCP about vaccinations for your baby if you used KESIMPTA during your pregnancy. Are pregnant, think that you might be pregnant, or plan to become pregnant. It is not known if KESIMPTA will harm your unborn baby. Females who can become pregnant should use birth control, contraception, during treatment with KESIMPTA and for 6 months after your last treatment. Talk with your HCP about what birth control method is right for you during this time. Are breastfeeding or plan to breastfeed. It is not known if KESIMPTA passes into your breast milk. Talk to your HCP about the best way to feed your baby if you take KESIMPTA. Tell your HCP about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. How should I use KESIMPTA? See the detailed instructions for use that comes with KESIMPTA for information about how to prepare and inject a dose of KESIMPTA and how to properly throw away, dispose of, used KESIMPTA Sensoready pens or pre-filled syringes. Use KESIMPTA exactly as your HCP tells you to use it. Your HCP will show you how to prepare and inject KESIMPTA the right way before you use it for the first time. Do not inject into areas where the skin is tender, bruised, red, scaly, or hard. Avoid areas with moles, scars, or stretch marks.
KESIMPTA may cause serious side effects, including injection-related reactions. Injection-related reactions are a common side effect of KESIMPTA. Injecting KESIMPTA can cause injection-related reactions that can happen within 24 hours, 1 day, following the first injections and with later injections. There are 2 kinds of reactions: at or near the injection site. Redness of the skin, swelling, itching, and pain. Talk to your HCP if you have any of these signs and symptoms. That may happen when certain substances are released in your body: fever, headache, pain in the muscles, chills, tiredness, rash, hives, trouble breathing, swelling of the face, eyelids, lips, mouth, tongue and throat, and feeling faint or chest tightness. Contact your HCP right away if you experience any of these signs and symptoms, especially if they become worse or you have new severe signs of reactions after subsequent injections. It could be a sign of an allergic reaction, which can be serious. Low immunoglobulins. KESIMPTA may cause a decrease in some types of antibodies. Your HCP will do blood tests to check your blood immunoglobulin levels. Liver damage. KESIMPTA may cause liver damage. Your HCP will do blood tests to check your liver before you start KESIMPTA and while you take KESIMPTA if needed. Tell your HCP right away if you have any symptoms of liver damage, such as yellowing of the skin and eyes, jaundice, nausea, vomiting, unusual darkening of the urine, feeling tired or weak. The most common side effects of KESIMPTA include upper respiratory tract infection,
with symptoms such as sore throat and runny nose, and headache. Headache. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please see full prescribing information, including medication guide, on this site or at www.KESIMPTA.com.